Thank you for joining us on your Sunday afternoon. Perhaps you'd prefer to be watching a football game or a restful afternoon with all your electronic devices on hold mode. But instead, you decided to join us, and we're honored by that decision. It inspires your presence at this, really inspires us to continue our work at the foundation, gives us some energy. I'm Mary Ellen O'Keefe, and I'm president of the board as of spring of this year. And I'm pleased to help lead this organization. Also want to introduce you to our fabulous, hardworking volunteer board of directors. Connie Huffine, Angel Teedy, Elaine Walsh, and Donna Brazel. Thanks to our sponsors, we have our hero sponsor, Floss General and Cosmetic Dentistry, our champion donors, sponsors, Seattle Children's, Connie and Charlie Huffine, Mason Huffine of The Green Builder in Seattle, Nina Ramsey, Elaine Walsh, myself, and my spouse, Marie Eaton. So our agenda today is designed to provide you with a glimpse at the legacy of Dr. Lois Price Spratlen. After a few introductions, we're going to hear from one of our nurse leaders, Dr. Deirdre McHugh. She'll give us some insights into the world of psychiatric nursing 2022. Then you'll each have an opportunity to participate in a small group discussion with other Gala participants. And last, my favorite part, we're able to meet and hear from our 2022 nurse scholars. Introductions. So as I perused the guest list today, I realized that we were in the company of many individuals of distinction. And I want to acknowledge a few of those guests and the organizations that are represented here today. These individuals and organizations are giants in our nursing community. And as a foundation, we're honored to work beside them in supporting nurse scholars. First, I want to just, as Pat did earlier, acknowledge that we have previous scholar recipients. We really appreciate their ongoing connection with the organization and their support. Next, we have a number of nurse educators in the group today. They have been doing heavy lifting in our institutions of higher learning for quite some time during difficult times, and I want to thank you all for your work. In particular, I want to recognize Nancy Woods, who is Dean Emerita at the University of Washington School of Nursing. There's Kristen Swanson, current Dean of the School of Nursing, Seattle University. Next, we have two organizations of distinction. First is the Mary Mahoney Professional Nursing Association, which was near and dear to Lois as well as Thaddeus. Mary Mahoney Professional Nurses Association has for decades mentored and financially supported nursing students of African heritage. If you've ever gone to their meetings, I sat there once and watched them give out $30,000 worth of scholarships. I was just amazed. So when we grow up, we want to be like the Mary Mahoney Professional Nurses Association. Next is the Association of Advanced Practice Psychiatric Nursing, which was near and dear to Lois as well as Thaddeus. It's affectionately known as AAPPN. It's an organization composed exclusively of advanced practice psychiatric mental health nurse practitioners. It offers peer support in educational programs. And last but not least, I want to acknowledge the Spratlen family's ongoing support, represented here today by Pamela Spratlen. Her siblings are Townsend, Paula, Patricia, and Calfani. For the Lois Price, talk a little bit about the history here so you know what we're about. The Lois Price Spratlen Foundation was founded to honor the spirit and legacy of Lois Price Spratlen. It grew out of a scholarship program started at AAPPN. We had wine grabs and gift baskets, and we would maybe do one or two scholars, but in 2016, we decided to become an independent 501c3 in order to make it tax deductible for our donors, as well as give out more scholarships. So why did we choose to name the foundation after Lois? Lois was an educator, an advocate, and a challenger. I'm told that when she would call people, she'd greet them, and then the next sentence out of her mouth was, I need you to do this. So the foundation was founded in response to this call for action and builds upon her commitment to education and her pursuit of social justice. So without further ado, I want to introduce Dr. Deirdre McHugh. Dr. McHugh began her career as a nurse in community health in Portland, Oregon. She's a graduate of the Psychiatric Mental Health Nurse Practitioner program at Oregon Health Sciences University and a Doctor of Nursing Practice at Seattle University. She's worked every aspect of psychiatric mental health nursing I can imagine: public health, rural health as part of the National Health Service Corps, inpatient, outpatient, pediatric clinics, primary care, corrections of all things, and adult outpatient mental health specialty clinic. She's currently Director of Development at Lavender. She's also an adjunct faculty at Seattle University School of Nursing. Her research focuses on providing equitable, trauma-focused, holistic healthcare. And with that said, Dr. McHugh, I'll hand it off to you.
Thank you so much. It's so strange to have myself introduced in that way to a group of nurses who I believe groomed me to be the nurse practitioner who I am. It's an honor to talk with you today. And I'm here to talk to you today about my experiences as a clinical director in a virtual mental health care company. But before I do that, I want to take a moment to express my gratitude to the Lois Spratlen Foundation and to the Spratlen family for this opportunity. I moved to Seattle in 2014, and so I didn't have an opportunity to know Dr. Price Spratlen, but I believe I have been witness to her greatness as it shines through the members and volunteers of this foundation and through the scholars whom I have personally known who have been awarded financial assistance from the Lois Price Spratlen Foundation. Thank you for being here and for allowing me to be here in celebration with you and with our scholars. So my talk today is about expanding our reach in psychiatric nursing with a goal of highlighting for you how we might achieve this through virtual healthcare, not only to create accessible services for patients, but also to inspire enterprise and innovation among mental health care nurses. And what I want to emphasize in all of this is that virtual care expands access to different types of patients. And at the same time, it also has the potential to expand patient access to different types of us. So to do that, I'm first going to share with you a little about my current team at Lavender Psychiatry, and then tell you about the advantages that I see when providing healthcare online. After that, I'll end with my challenge to you. So a little bit about Lavender. Bullet points. Lavender is a virtual mental health care company that was started by two DNP prepared nurses in May 2020. Lavender is nurse-led, nurse-founded, and employs psychiatric nurse practitioners exclusively. We provide therapy and medication management for the most common psychiatric diagnoses, and we focus on treating conditions that we believe are safe to treat within a virtual online platform. Our nursing values and our ethics are carried with us into our encounters with our clients and with one another. Just as Dr. Price Spratlen did, we believe in nurses training nurses, and we believe in nurses practicing at the full scope of their training. To this end, every new nurse practitioner meets weekly with an NP mentor, and time is built into schedules to have that mentoring, and bonuses are built around successful mentoring. We endeavor to operate in places where nurse practitioners can function independently without physician supervision or collaboration. And functionally, that means that we pay our nurse practitioners to take the time to talk to their legislators, to advocate, to maintain and expand our scope. Because we're 100% online, we are not bound by region. Clients who live in nursing shortage areas can see their nurse practitioners from areas where there are lots of nurse practitioners. Potential clients don't have to settle for the only available psych provider in town. They can choose. We find that when Black and Brown clients can select their own healthcare provider, they prefer to see people who they believe will provide culturally relevant services, who will understand their transgenerational backgrounds, and who are likely to see their traumas for what they are, as expressions of systemic racism, and not overly pathologize those experiences as psychiatric symptoms. We treat mental health care like a hospitality industry. We believe that this is the only way to achieve trauma-informed care. If people are dissatisfied, we do our best to make it right. And that could mean a complimentary session with someone else to see if that's a better fit, or could be a discussion with a manager so that people feel heard. And this isn't meant to be punitive. We believe the research that indicates that patient experience impacts patient outcomes. I want to say that, especially in mental health, there is a lot of research that supports this. We see adults who are commercially insured, and this is the place where we think a company like ours can have a vast impact on mental health stigma and reach people who in the past did not see mental health care as necessary health care. Our clients are working people who can't miss work to attend appointments. They're busy people who historically did not seek mental health care because of competing priorities of family, school, and work. We are proud to see a higher proportion of peripartum parents, male gendered people, and people of color across the lifespan than many of our brick and mortar counterparts. And lastly, and I think this is really strange, we interview about 15 NPs per week. And at the end of every month, we hire only about 2 people. And currently we operate in 5 states. We're finding that nurses apply expecting that we will operate like other healthcare companies and agencies that they worked for before, where they've been indoctrinated to prioritize medications over therapy and behavior change, to pursue high caseload numbers rather than focusing on quality care that emphasizes the patient journey toward recovery. We see so many NP candidates who have been treated like physician extenders rather than nurses, who are philosophically wholly different from physicians. Essentially, we have unabashedly declared we are nurses. We support nurses in the nursing process, and clients who come here will get access quickly to nurse professionals who understand their cultural needs and who will take the time to ensure that feelings are respected and cared for. It has been alarming, and frankly, not all nurses who meet with us for an interview agree with this declaration. We know that there is a place for each of us in healthcare, and this is what we declare, what we want, the workplace and the world that we want to invest our skills into. I could talk all day about why I love where I work, but I'll focus more on the virtual healthcare realm in general right now. So it's easy to forget that virtual care didn't really exist until the early 2000s. In fact, the smartphone, a phone with internet access, wasn't available until 2007. In 2011, the Pew Research Center identified that only 35% of adults in America owned a smartphone, whereas in 2021, 97% of adults in America have a cell phone and 85% of Americans have a smartphone. My earliest memories of mental health care delivered virtually was in 2005 to 2007, when I worked in the Oregon Department of Corrections. There, a nurse practitioner spent 3 weeks a month talking to inmates at other institutions by video conference, and then 1 week a month, she would get on a plane and fly from institution to institution in order to provide in-person, face-to-face care. And then when I became a psychiatric nurse practitioner, I was able to have some telephone visits with clients who I had seen in person in the past, but there was a limit on how much I could legally utilize phone appointments, and insurance limited how often my agency could get paid for it. We think of the VA as being a pioneer in telehealth because of its early adoption for armed servicemen and women in deployment. In fact, it was the VA and the Department of Defense who advocated for legal changes in 2017 that would allow anywhere to anywhere services, meaning that the healthcare provider could be located anywhere and the patient could receive that care from anywhere. 2017 was only 5 years ago. For those of us who don't love doing the math, that was really recently. So it was just 5 years ago that telehealth was mostly inaccessible to all but a few in special situations. So in the emerging digital healthcare world, the laws are not keeping up with our desire for change. But because of COVID and the global lockdowns, lawmakers, healthcare providers, governing bodies, and professional organizations had to shift. I don't know if it really was nominated as such, but the word of the year for many industries in 2020 was pivot. We all had to pivot our thinking and our operations. Prior to the pandemic, groups who had the greatest access to virtual care were people who are veterans, people who are utilizing Medicare and Medicaid, people who are living in skilled care and long-term care facilities, and the incarcerated. Ironically, people who live in America who have commercial or group health coverage, the largest population of healthcare utilizers, have had the lowest access to telehealth. During the pandemic, rules that barred anywhere to anywhere services were lifted, allowing psychiatric NPs to pivot from in-person care to seeing their clients online from home. Our clients were able to safely get their mental health care from wherever they happened to be, in their car, in their home, or in the case of our patients who are also healthcare workers, from their work break rooms. Now, even as the public health emergency has been lifted in many places and settings, still many healthcare providers desire to see their patients online. What happened with COVID, in a sense, has been a natural, non-replicable experiment where we have been learning that virtual care has fewer disadvantages than we assumed. We assumed that clients and patients wouldn't like it and would feel a lack of rapport with their nurse care providers. In fact, we're finding that clients often prefer it. They see glimpses of our lives and our interests by video. They are more able to reach nurse practitioners who meet their cultural healthcare needs and who understand their specific social determinants of health from a place of knowing. Clients love the ease of access. As a little thought experiment, ask yourself, when were you last excited for the opportunity to sit in a waiting room? People don't have to do that anymore. And in the case of a potentially stigmatized health condition, we find that people who were not accessing services due to stigma are now engaging in needed treatment because they feel that their privacy and their anonymity are protected. We also assumed that the care we provided online would be suboptimal or not equal to the care we provide in person. But the facts are simply just not bearing the truth to this assumption. And so when we had to shift our practices, we rationalized that virtual care was better than no care at all. But the tech world is ready to step in. And now we have all kinds of gadgets that make remote monitoring possible. We can track vitals remotely. We can conduct movement exams. We can check skin for bruising and rashes. We can monitor sleep with smartphones and watches. And we no longer have to rely solely on subjective patient report for this data. I can think of a few caveats to online care. Those of you who are in-person psych providers probably recall noting on a mental status exam every now and then when a patient was like malodorous. And it's true that we can't smell our patients when we see them online. But there is a richness that before online appointments, I didn't know that I was lacking. I see people in their homes, in their cars, or on sidewalks. I see their distractions, the noises and lights and people that distress them. I see their messes, their changes in their ADLs. I meet their pets, their children, their partners. They share with me their collections, their art, their hobbies. And I can do pill counts. I never got to do pill counts like I can do them now because I don't have to rely on their remembering to bring all their medicine bottles with them to the office. Pill counts is like real nursing case management right there. If you had to decide between seeing your patient as a whole person embedded into a family and a community, or to see only one facet of that person, the way that they show up at your office in a very prescribed setting, what would you choose? And I've told you about my current outpatient virtual practice, but before you say sure, but what about people who need more support? What about opiate use treatment or detox or day treatment? There are virtual tech tools that make remote monitoring for these types of care possible too. There are virtual care providers who successfully treat substance use disorders online and by phone. There are online day treatment and intensive outpatient programs that reach people who would never have had access to this level of care before. And of course, there are times when in-person care is best. This will always be true. But any of us who have ever worked as nurses in a face-to-face care setting can recall those people who were not ready for discharge, but who left AMA because they had no one to care for their cat, or because they hated the food, or because they felt unsafe with the staff or with other patients, or they were worried about a loved one who was still at home. If some of these patients could be treated with remotely monitored virtual care, why wouldn't we offer that as an alternative to no care at all? So now I'm going to kind of transition to talking more specifically about telehealth laws and the restrictions and waivers currently in place for virtual care by nurse practitioners. With the amplified healthcare shortage created from COVID, our healthcare system essentially put a stay on any laws that impeded virtual care access. And from the patient perspective, that meant they could stay home, talk to their nurse practitioner by phone or video. And part of the increase in smartphone access was the renewed and increased funding of the Lifeline Assistance Program, which is a federal grant that began in 1985 to support phone access for emergency service by paying for low-income households to have phones. So it's part of the reason that online care has been so successful thus far with people who are on Medicaid and Medicare. Incidentally, Lifeline Assistance lost its COVID-related funding this year, and more changes that helped us transition to telehealth may also be sunsetting. Another thing that patients noticed is that the types of care they were seeking was easier to access than before. For psychiatry patients who pre-COVID had to wait 3 months to get a new patient appointment, they could get a new appointment in a matter of weeks. It also meant that medications that required monthly, weekly, or even daily visits didn't require these in-person visits at all. Consider the patients who take methadone maintenance therapy for treatment of opioid dependence, who one day had to go to the clinic every single morning for their medication, and then suddenly being allowed to get a week's supply of medication or more. You might think that this could jeopardize their sobriety or put them at risk for relapse, but again, the evidence from the past 2 years indicates that patients who take methadone maintenance do so because they desire sobriety, and they have not been more likely to relapse when given the ability to self-manage their medications. Stimulant prescriptions are another case example. Prior to the pandemic, people who take stimulants to treat ADHD needed an in-person encounter every month in order to get a new prescription for their daily, regular, long-term medication use. As we know, ADHD is a neurodevelopmental condition with a chronic and a lifelong course. So people who benefit from stimulant medication are socially prescribed to see themselves as chronically sick and requiring monthly specialist maintenance. And then suddenly the rules changed, the restrictions lifted, and they can see their nurse practitioner online. They don't have to miss school or work in order to have their symptoms addressed, to have their appointments or to obtain their medication. They haven't had in-person appointments in over 2 years. And as far as they believe, this system has worked conveniently for them. As an aside, I have always been bothered by the practice of taking children out of school in order to sit face to face with someone who will force them to talk about their lagging behind in school. This seems antithetical to the practice of patient-centered care, but we do it because the law says we have to. Except the law says that we don't have to when certain conditions are met. One of those is a public health emergency. Now that that emergency is ending, and after years of successful virtual care, previous rules are starting to be reinforced. Laws pertaining to laws are reverting back to pre-COVID status. specifically the Ryan-Haight Act, and that will be a disservice to our patients. Thankfully, there are reputable telehealth providers, professional societies, and nurse organizations that are pushing for changes at the federal, state, and local levels. And various pieces of legislation are being brought forward that will have a positive impact on our ability to continue to provide virtual care. Here also is where I'm going to remind you that we all need to vote very soon. And then from the perspective of a healthcare provider, what I have seen is an increase in engagement from my patients. I've already mentioned the rapport we're able to develop. I also have a significantly fewer no-show rate and a late start rate. In the community mental health clinic where I served as the medical director before COVID, our no-show rate was 20 to 30%. And after virtual care, that no-show rate with the same clients dropped to about 10%. Where I work now, it's even lower than that. And regional restrictions, barriers of geography and topography are no longer interfering with our ability to work with the people that we want to work with and care for the types of clients we want to care for. I have a colleague who's from Washington State, currently living in Madrid and continuing to see her clients from back home. And as a healthcare provider who is also a healthcare recipient, I love that I don't have to take off a day of work in order to see my own therapist. Also, at the federal level, any requirements for nurse practitioners to have collaborative agreements with physicians was temporarily paused. Nurse practitioners who have never been allowed to practice autonomously were able to do so, and our nurse practitioner colleagues in states with restricted practice could experience the autonomy that they were trained to provide. As the pandemic wore on, some states that had restricted practice decided to continue to allow autonomous practice post-pandemic, or they've created a roadmap for eventual autonomous practice. California is a good example of this. They had a very restrictive practice for NPs, and they've now developed a 3-year transition plan that will permit NPs to practice autonomously after 3 years of supervised practice. Others, like Colorado and Massachusetts, have adjusted collaborative practice agreement requirements so that nurse practitioners can provide oversight of their new nurse practitioner colleagues for a designated time period before they achieve autonomous status. Essentially, states are finally allowing nurse practitioners to maintain their nursing heart and nursing ethics as they transition to advanced practice. And I think that's a lovely compromise. So here's my call to action. In my day-to-day work as a PMHNP and a DNP in virtual care, I see changes all around me that inspire optimism. I see nurses who come from communities of color positioning themselves to be care providers for their home communities. I see Black and Brown nurses in leadership roles who are able to leverage the virtual platform to increase their visibility to potential future nurses and to patients alike, so that people have leaders and role models who look like them and who come from regions and cultures that they themselves come from. I see nurse innovators who are establishing novel partnerships with technology professionals in order to get those technological advances embedded into healthcare delivery systems. I see nurse entrepreneurs building new models of care that fit with our shared ethics, with our own individual callings. And I see nurse champions who dedicate themselves to the business of advocating for our nursing profession. Nurse practitioners carry a legacy of creating novel solutions for long-standing systemic healthcare problems. And we are in the midst of a brief societal pivot wherein we are embracing virtual care as a venue for high quality, highly accessible services. And we have just a moment to demonstrate our right to inhabit this space as nurses with our nursing uniqueness intact. The rules are being rewritten, the roles are being redefined, the restrictions are being reimagined. So here's my challenge to you. In this pivotal moment, what can you unabashedly declare? Whatever your passion, there is a place for you in the virtual landscape. What will our nurse scholars be allowed to reimagine and redefine? How will we support and mentor them as they embark on their NP journey? I'm going to end there. though I encourage you to consider those questions as we hear directly from this year's award recipients. And I'm really excited to hear what they have to say.
Okay. Hey, our scholarship committee.
Hi.
Wonderful, wonderful people have been with us for quite a while. They just don't give up. They keep coming back year after year to be on this committee. Janice Dicio from Seattle University. Ann Mason, who has been on, both of these have been on our board before. Ann Mason, Washington State University. Jeffrey Ramirez, Gonzaga University. Jean Tang from the University of Washington, and Elaine Walsh from the University of Washington. So I want to thank Dr. Walsh for her leadership on this scholarship committee year after year. She updates the criteria, solicits applicants, gathers information, and then she convenes our scholarship team. They review the scholarship applications blindly, I think, and then they make the difficult decision of who will receive the scholarships. Sometimes they just tell us, we can't decide and you need to offer one more scholarship. So Elaine, I'm going to hand it off to you.
Thank you. And we are actually really excited to be joined by Jane Nankawanki, who is, I'm going to say it wrong every time, she was my student and I still can't say it. I'm so embarrassed. Nankukoihi, who has been kind enough to also help us with reviewing scholarships. Before I start, I also just want to acknowledge that we have lost one of our wonderful donors, Alice Maliu, and it was earlier in the year. And we just wanted to speak a bit to her legacy and thank her for all the contributions that she's made. And we know that her presence in students' lives made a big difference. So we honor her and thank her for her contributions. This year, we are excited that we're able to award 5 scholarships. We actually had 11 applications, and as always, we wish we could award them all. Fantastic applications, terrific scholars, and we are going to be able to award to 5 of them. Those of us who reviewed, if it is a person connected with our university, we did not review that application, so there were combinations of ways to look at the information so that we were blinded to those as well. Scholarships are now $2,500 instead of $2,000, and we're really excited at the generosity of donors to be able to increase that amount as well. So what I'm going to do now is go one by one, introduce our scholar. I'm going to read a brief biography of each of them in alphabetical order. I'm going to start, and then what I'll do is I'll finish that one person's biography. I will then turn it over to them to say a few words, and then we'll go back and forth so that you don't have to listen to me read constantly, and you can listen to our terrific scholars. So to begin with, I'm honored to introduce Cordelia Cochran. Cordelia is a DNP, PMHNP track student at Seattle University, and she is class of 2023. When she was a mental health therapist in community mental health, she consistently saw there were gaps in access to care for marginalized populations, specifically when it came to access to providers. That's why she decided to enter her program to become a family mental health nurse practitioner. She wanted to be part of the solution and wanted to help fill in those gaps of care. Cordelia plans to eventually mentor others who want to become providers, which is music to our ears. She currently provides mental health therapy for injured workers who have claims with labor industries, or L&I, and notes that there are very few psychiatric providers that also work in L&I to refer clients to when it is apparent that a worker might need some psychiatric medications. Once she completes her degree, she plans on transitioning her role to providing care via psychiatric medications. And it is her hope in that new role, she'll be able to help clients have a true holistic approach to their health care. She plans on entering a PMHNP 5 to 10 year residency post-graduation and creating a mental health and chemical dependency community agency. This goal will allow new leaders to form in addictions medicine and will also help a community that is under-resourced. Cordelia, the floor is yours.
Hello. Hi, everyone. Thank you so much for having me, and thank you so much for I mean, really awarding me this scholarship. It's going to be just so helpful in my journey as I continue. Yeah, so I guess, I mean, that's my bio kind of says it all, right? And, that's what I really want to do. I actually want to create a residency for PMH&P folks once I get my agency get it going. I want to say thank you to my lovely parents who are right next to me. They are the best support that I could have ever asked for and wanted. They've supported me all through my educational journey, and also Seattle University and some of the professors and Dr. DeSocio, and they've just been so supportive of me as I continue through this program, and I'm almost done. But yeah, so that really is the goal of mine, is to expand access to care as much as I can in these varying areas. Addictions medicine has really started to capture my heart, as well as working with injured workers. And so I think it's just so important to continue to support and educate people on how to support this, under-resourced community that we see so prevalent in all areas of the state, right? I could just say Pierce County, but I mean, everywhere, we all need some support in that area. Yeah, so that is what I want to do, and I'm going to be shooting for it. So look for us in 10 years. I don't have a name yet, but I'm going to have it. And I really can't wait to help mentor and educate the future leaders in our communities, especially who are nurse practitioners, so we can do our best. So anyway, thank you, everyone. And I mean, thank you again for this time.
Cordelia, thank you. It's so nice to hear directly from you about your plans, and I'm excited for you and for all of us who are going to benefit from your work. Our next recipient is Ramisha Lal, and Ramisha is a DNP student at Seattle University, class of 2024. This is her third year, and she's a student in psychiatric mental health nurse practitioner program. She's currently in school and working as a registered nurse at a mood and anxiety treatment center in Seattle. And before she graduates, one of her goals is to conduct research on prevention and early intervention in youth mental health for middle school students in King County. By currently working with diverse adolescent patients who face social inequalities, she knew that there was a high need in children to receive education on common psychiatric disorders and address topics such as bullying, self-esteem, anxiety, and stress. Coming from a South Asian background, Ramisha would also like to be able to discuss how mental health may be perceived in different cultures and how her generation can face those barriers and stigmas within it. As a long-term goal, she would like to improve mental health access for under-resourced populations by being part of an interdisciplinary team that provides psychiatric telehealth services at low cost to residents of rural areas. What sparked her passion in this field was being able to empathize, and help LGBTQ youth in mental health crisis on a nursing level, and then being able to observe how an advanced practice nurse was successfully able to utilize therapeutic interventions and affirming treatment for those patients. Childhood behavioral health is essential to well-being across the lifespan, and Ramisha looks forward to learning more and working with this population as she grows in the profession. Ramisha, the floor is yours.
Hi there. Thank you so much, everyone. I'm so grateful to be awarded this scholarship and have the support from the committee to help me reach my goals. And I also want to thank Seattle Youth faculty, Dr. DeSocio, Dr. Angel Tiade, and Dr. Swanson for all the support as well. Working on the adult floor and children's floor of this treatment center has made me realize the need for early prevention and promotion of mental health education for the youth. And I envision myself utilizing this scholarship for research and education. I want to be able to use approved curriculum to educate a diverse range of students in public middle schools within King County. And I look forward to connecting with the youth through discussions of what mental health may look like in different cultures, and share my experiences with stigmas in the South Asian community in hopes that younger people will be better protected from risk factors and also be able to access resources without the fear of stigma. Thank you again.
Ramisha, thank you. Cannot wait to hear about your future. Our next recipient, Miriam Uluyinka, was born and raised in Miami, Florida, and is a second-generation Haitian immigrant. She's a second-year Psych DNP student at Seattle University. We have a theme here. Her short-term goal upon graduating is to either complete a psych residency training program or work in an outpatient setting as a Psych NP. Her long-term goal is to be able to work in ethnically and culturally diverse communities, specifically in communities where mental health providers are inaccessible or underrepresented. What sparked her passion to become an advanced practice Psych NP is a direct response to her experiences in life and in work. She has continually seen that there was a lack of diversity amongst mental health care providers. Later on, she realized that there was an opportunity for her to be part of improving access and opportunities for those who have been marginalized by the mental health care system. Her hope is that by becoming a Psych NP, she can be part of leading change in the way mental health care is delivered to ensure that all individuals, regardless and in consideration of their race, culture, and ethnicity, will receive proper mental health care and support. Miriam, the floor is yours.
Thank you so much. Thank you for choosing me to be a recipient of the Lois Spratlen Scholarship. I feel extremely honored to be able to represent the scholarship because it is named after an African-American woman who left a mark on everyone and everywhere she went. Prior to me applying for my Psych NP degree, I've been a nurse for a long time, probably about 14 years. And for the longest time, I never desired getting my advanced nursing degree. Maybe I just didn't think it was a possibility for someone like me. But when I became a member of Mary Mahoney and hearing about Lois Spratlen from members who personally knew her had a profound impact on me. Because when they would share about her, they would get emotional because they personally knew her and the personal experience that she impacted on them, the impact that she had on them, as well as those in the community. When they would share, they would elaborate on how she was a professor and the first Black female ombudsman at UW, her involvement in advocating for more practice authority for nurse practitioners in Washington State, her active involvement in her membership in Mary Mahoney, and her writing of an inspiring book on the history and plight of African-American nurses in Seattle truly had a life-changing moment for me. This was a woman who truly is a legend. And I believe that in receiving the scholarship, that she is some way passing the torch to me to really understand the power and ability I have to change how healthcare is being provided to those belonging to marginalized communities. So in my life journey and growing up in Miami, Florida, being from a family of Haitian descent, having a husband who's Nigerian, and currently working in an acute psych facility in Seattle, my ultimate goal is to be able to help empower diverse communities to adequately address mental health while acknowledging their cultural experiences. It feels like a tough feat to achieve, but in receiving the scholarship helps me to believe in the impossible. Thank you.
Miriam, thank you. Our future is in good hands. Our next scholarship recipient is Lilia Pung, and she is a third-year Doctor of Nursing practice student in the Psychiatric Mental Health Nurse Practitioner track at the University of Washington. Lilia began her healthcare career as a naturopathic physician. She earned her Doctor of Naturopathic Medicine, her ND, degree at Bastyr University and completed her residency in chronic disease management at the Quest Center for Integrative Health in Portland, Oregon. She was inspired to pursue additional education to specialize in mental health after witnessing the significant need for psychiatric care among her patients. Lilia plans to integrate her advanced practice psychiatric nursing education with her background in naturopathic medicine to provide holistic and integrative care, mental health care, to underserved communities. Her primary interests are improving culturally sensitive mental health care for Asian Americans and Pacific Islanders, and advocating health equity for marginalized groups, especially the BIPOC and LGBTQIA+ communities. She also hopes to contribute to the education of future advanced practice psychiatric nursing students through preceptorship and mentorship. And for her doctoral project, she's partnering with a community health clinic that serves the Asian American Pacific Islander community on creating educational videos to increase patient engagement in behavioral health services. Lilia, please take the floor.
Good afternoon, everyone. I am so very grateful and honored to be a scholarship recipient this year. And as was mentioned, I am particularly passionate about serving and advancing health equity for the BIPOC and LGBTQ communities in behavioral health. And I look forward to working towards those goals in both my DMP project, which is with the Asian American Pacific Islander community, as well as my plans after graduation to work for a community health agency serving primarily Asian immigrants and refugees, where I will also hopefully be able to precept students and carry on the foundation's mission of supporting the education of future psych nurse practitioners. So I just want to say thank you so much to the foundation, to the Spratlen family, and to all the donors for your generosity and your support. And thank you also to my family, my professors, and all my preceptors, some of whom I see here, including Dr. Marianne Murray and Dr. Jean Tang, for all their support and contribution to my education. Thank you so much.
Thank you, Lilia. How exciting to hear you combining these wonderful backgrounds together for moving forward in practice. And last but not least, Keandra Rustin. Keandra has been a registered nurse for almost 15 years, and she has a background in cardiac medicine, critical care, and emergency medicine. She has worked in academia and simulation for 10 years and has been very active in serving her community. Keandra has recently served as the chair of the Healthcare Systems Modeling and Simulation Group for the Society for Simulation in Healthcare, as well as the chair of the Clinical Innovations Group for the National Education in Nursing Collaborative, and is leading member of the Education and Training Group for the Medical Device Innovation Consortium. She currently serves as a chair of the Healthcare Systems Modeling and Simulation Group for the Society for Simulation in Healthcare, is the new president-elect of the Mary Mahoney Professional Nurses Association, and a member of the Health Equity Zones Committee. She has a passion for education, providing nursing care and technology, as well as erasing the stigma of behavioral health while advancing and transforming health for all. And she is a University of Washington student. Keandra, the floor is yours.
Hi, everyone. Thank you so much for letting me be a recipient of this award. Like Miriam, I read a lot about Lois Spratlen Price, and I really admire her. And she was a strong reason for why I wanted to join Mary Mahoney. I do have to apologize. I'm one of the thousands of people that don't have power in Linwood right now. So I'm taking this in my car because it is very dark in my home. My goals I didn't write down because I wanted to explain a little. I have a lot of lofty goals. One of which is to make a mobile health clinic that provides a one-stop shop for all healthcare needs for patients so I can provide a better access to them, go to where they need it the most. Very similar to street medicine, but there would be a behavioral health team, x-rays, all sorts of other services that would be provided there. I'm currently developing an app using augmented reality and trauma-informed framework so that people can access healthcare online. It would have an algorithm that would trigger immediate help if there was someone with suicidal ideation or someone in opioid withdrawal symptoms or other substance abuse withdrawal symptoms. I'm hoping that the scholarship will help me to continue to build upon that work. I'm also working on a new game. It's a serious game for simulation involving psychiatric care, teaching students how to care for patients with behavioral health issues in a more humane way and using trauma-informed methodology. I'm just really grateful, and I can't say enough how in awe and humbled I am to receive this. And I hope that I can continue what I'm doing. I am a first-year student at University of Washington, and I'm learning a lot from everyone there, including all the wonderful people at Mary Mahoney. Thank you, everyone.
Thank you, Keandra. It has been my delight and pleasure to be able to introduce these 5 fantastic scholars to all of you. You can see what a difference your donations make, and we're thrilled to have you all with us and to have you part of our fold, and look forward to having you join the profession. I'm going to turn things back over to Pat. Thank you, everyone.
Thank you so much, Elaine, and congratulations to all the scholars. I've enjoyed the exchange of emails and I will be in touch more as we go through. I also want to acknowledge and thank Appen, because part of receiving a scholarship is that you will get a registration to an Appen conference and a one-year membership. And I know Chris and Kurt are here. I welcome them to unmute themselves if they'd like to share anything more about that.
Well, thanks, Pat. We're so glad to be here today and so glad to see these amazing scholarship recipients, a couple of whom I've known, and Lilia volunteered with us at our conference recently. So I just want to thank you all and also say that we really look forward to seeing you at our next conference. And we're so glad to have you become members of Appen so we can all work together for the profession. Thanks.
Thanks so much. And I also want to acknowledge that I see Butch DeCastro is here. Butch is the Associate Dean for Diversity, Equity, Inclusion at UW. So good to see you here again this year. So now, you've seen that through the conversations that we've been having, that the Lois Price Spratlen Foundation has made significant strides during its early years. Those of you who know and have been part of us from our founding, with today's awardees, we've now awarded 27 scholarships and 2 community grants. That's something we're really proud of. And that's because, like Dr. Lois Price Spratlen, who used to contact you and say, here's what I need you to do, we've done the same to you, and you've responded by providing this generous support. And we're so very grateful to those of you who responded early by making your gifts when you registered for this event. We really appreciate it. It was because of you that we were able to award the 5 scholarships this year instead of 3. And as was mentioned, to be able to increase going forward from now on how much we'll be awarding each year for scholarship up to 2,500. So thank you for that. As you all know, you've been part of this. We want to talk a little bit about support and what that means going forward. And Dr. McHugh, you made a generous gift to the gala this year. You were one of the people who made that early gift. Would you mind just sharing with everyone why you decided to support the foundation this year?
Sure. So it felt like an easy choice. I chose to renew my contribution to honor those who've helped me both professionally and financially, including people on this call. And I know it's people like our scholars today who will seize the opportunities that the future of nursing presents. I know it's the people on this call today who will continue to advocate for the full scope of nursing practice and who will pave the way for new nurses and advanced practice nurses through funding and through mentoring. And so it's an obvious decision to help people from my own community, from the universities within Washington.
Thank you. Thank you so much. And how well that speaks to when I especially look at our scholarship recipients this year. I'm very excited about how much they've accomplished already and what their plans are for the future. So thank you. And thank you for that call of action too, through your keynote today, because the theme for this year, that this coming year, we always launch at our gala what our theme is, and it is expand the reach. And that's what you addressed. And that's what we're asking each of you to do today, to make a commitment to expand the reach of your work in a way that addresses this lack of access to mental health care for some and diversity of advanced practice psychiatric nurses in our communities. And that's what we think we do with our scholarships and through our community grants. Now I want to share that Connie and Charlie Huffine are offering to expand the reach of your gift today. They've issued a fundraising challenge in honor of the values of the foundation's vision of a world where all mental health well-being is valued and nurtured. They've committed to matching dollar for dollar your gala contributions up to $2,500 for any gala gifts that are made today through November 30th. As you've heard me say many times before, the funds we raise between now and the end of the year helps us prepare in our budget, and it determines how many scholarships and how much community support we'll be able to provide in 2023. you've already demonstrated that you're willing to rise to the challenge through your support of this foundation and this gala. We hope, if you haven't already, or even if you have and you've been inspired today, that you'll consider giving to this challenge. And we encourage you to share the information with your colleagues to show their support too by making a gift. I'm going to be placing a link in the chat for the giving, and wanted to let you know again on our website, if you go to the gala page, you will find that there's a link there to make that gift. And we will be looking at that all the way through November 30th to help meet that challenge. We want to see Connie and Charlie write that check for $2,500, and that's one scholarship's worth. If we can raise those additional funds, that will help us put us towards 2 scholarships for next year at least. So thank you. If you have any questions, as always, you can contact me about either how to support the foundation or any other ways that you might want to participate. So I'll be dropping that in the chat here in a minute, but first let's get you set up to go out and have a conversation with our scholars for this year. So we're going to send you in a few minutes into breakout rooms. You're going to be with a scholarship recipient and one foundation board member. I'm sure during your conversation, you're going to be reminded not only of challenges you might have faced as a student, but also what it takes, significant community support involved in launching careers. And we hope that before you leave today and over the next couple of weeks, you'll be reminded of our mission in that we really want to, the vision of making all of the access equitable and diversifying the advanced practice psychiatric nursing and going into communities and expanding our reach.